Eating right for CKD. Eating right for CKD will help control chronic kidney disease (CKD). In particular, work with a dietitian to develop a meal plan that includes foods that you like to eat to maintain your kidney health. Eating right for CKD. Choose healthy foods for your heart. Your heart must work properly to provide enough blood for your kidneys to filter. Therefore, when the heart has problems, such as heart failure, heart valve stenosis, will lead to kidney damage. Many heart failure cases lead to end-stage renal failure and death. So, it is absolutely necessary to take care of a healthy heart. Heart-healthy foods. Vegetables such as greens, spinach, collard greens, kale, broccoli, cabbage, and carrots. Whole grains such as plain oatmeal, brown rice, and whole grain bread or tortillas. Fat-free or low-fat dairy foods such as milk, cheese, or yogurt. Fruits such as apples, bananas, oranges, pears, grapes, and prunes. Protein-rich foods. Lean meats such as 95% lean ground beef or pork tenderloin. Poultry such as skinless chicken or turkey. Fish high in omega-3 fatty acids such as salmon, tuna, and trout, about 8 ounces a week. Legumes such as kidney beans, lentils, chickpeas, black-eyed peas, and lima beans. Nuts, seeds, and soy products. Eggs. Oils and foods help lower blood cholesterol levels and the risk of cardiovascular disease. Some sources of these oils are nuts such as walnuts, almonds, and pine nuts. Seeds such as sesame, sunflower, pumpkin, or flax. Canola, corn, olive, safflower, sesame, sunflower, and soybean oils. Salmon and trout. Avocados. Tofu. So, grill, broil, bake, roast, or stir-fry foods, instead of deep frying. Try to limit saturated and trans fats. Read the food label. Cook with non-stick cooking spray or a small amount of olive oil instead of butter. Trim fat from meat and remove skin from poultry before eating. Limit alcohol. Drinking too much alcohol can damage the liver, heart, and brain, and cause serious health problems. So, ask your healthcare provider how much alcohol you can drink safely. Eating right for CKD. Eat the right amount and the right types of protein. Protein is found in foods from plants and animals. Most people eat both types of protein. Of course, eating more protein than you need may make your kidneys work harder. When your body uses protein, it produces waste. Your kidneys remove this waste. So, should eat small portions of protein foods. Better yet, talk to your dietitian about how to choose the right combination of protein foods for you. Choose and prepare foods low in salt and sodium. Good salt restriction helps control high blood pressure. Because kidney and blood pressure have a causal relationship. Specifically, your diet should contain less than 2,300 milligrams of sodium per day. Sodium, part of salt, is added to many processed or packaged foods that you buy at supermarkets or restaurants. So, buy fresh food often. Also, foods like fast foods, frozen dinners and canned foods have a higher sodium content. So cook food from scratch instead of processing. When you prepare your own food, you control what goes into it. Use spices, herbs and spices, without sodium instead of salt. And this is how you choose canned food, packaging, processed products in supermarkets. Check the sodium on the nutrition facts label of the food package. Daily values of 20% or more mean foods that are high in sodium. On the other hand, a daily value of 5% or less is low sodium. Also, look for the amount of saturated and trans fat listed on the label. Try lower sodium versions of frozen dinners and other convenience foods. In particular, wash canned vegetables, beans, meat and fish with water before eating. Look for food labels with words like free or unsalted sodium, or low, reduced or no salt or sodium, or no salt or slight salt. Choose foods with the right amount of potassium. Kali help your nerves and muscles work the right way. When blood potassium levels are too high or too low, damaged kidneys allow potassium to build up in your blood, which cause serious heart problems. Therefore, your food and drink choices can help you lower your potassium level. Salt substitutes can be very high in potassium. Read the ingredient label. Check with your provider about using salt substitutes. In particular, drain canned fruits and vegetables before eating. Also, some medicines also can raise your potassium level. Your health care provider may adjust the medicines you take. Eating right for CKD, choose foods and drinks with less phosphorus. When you have CKD, phosphorus can build up in the blood. Too much phosphorus in the blood pulls calcium from your bones. Makes your bones thin, weak and more likely to break. High levels of phosphorus in your blood can also cause skin itching and bone and joint pain. Many packaged foods have added phosphorus. Search for phosphorus or use words with a phos ingredient label. Alternatively, your doctor may use phosphate binders to remove phosphorus through your stool. Program Solutions for Kidney Disease. There are specific step-by-step instructions, free food recipes and food choices to eat. Try it free for 2 months. Learn more the link below in the description. Thank you for watching.